Hey everyone, I know it's been quite a while, but I am 7.5 weeks out of surgery and things are going pretty darn well. So I'll kind of back up from where I left off when I posted my last video, which was right before I started PT. So when I went in for my very first PT appointment, it hurt like hell. I'm not gonna lie, it hurt like hell. I felt kind of sorry for my therapist who, had to be the one to move my arm for the first time in 6 weeks. And I was very vocal about how it felt. And so hopefully there weren't any patients in the next room because as he was moving it, it just kind of was like, ow, 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 ow. So it was pretty darn painful. In any case, the first two appointments were probably the most painful. Just because it's so stiff, it's so not used to being moved, and you're just starting all that activation again. And as far as exercises go, when you're still in passive range of motion, which for me was 4 to 6 weeks after surgery, I was doing pendulums, and I have this little pulley system that I can put on the door frame, and it's got two strings on it. And I hold on to one and then pull it up with the other. And it was just a way of passively getting my bad arm to move up as high as it would go. I would just do it for 5 to 10 minutes, kind of do it if you're watching TV or you're just kind of having a conversation on the phone. You can just kind of sit there and use your little pulley and work on your passive range of motion that way. Pendulums, you just kind of lean over and you dangle your arm, as if it's an elephant trunk. That's kind of how I always thought of it. But when you're in that stage of physical therapy, you have to be really, really careful about not activating any muscles in your shoulder. It's really easy to, when you're doing things like that, to want to help it along, to want to, it's natural to want to activate the muscle in order to help it go where you think it should go, but you can't. So that's probably the most challenging part, was remembering not to activate any of those muscles and just staying completely relaxed. Staying completely relaxed actually was a huge, I'd say the key to kind of getting through physical therapy, because the way my appointments are set up, I spend the first half an hour with my therapist, and they sort of manipulate it. They kind of massage it a little. They try and get it to where it should go and loosen it up and open it up. And that's going to hurt a lot if you're really tensing the muscle. You really want to think about just completely relaxing the space that they're working on, and it'll make it feel so much easier and so much better when they are working on it. So just remember to relax and breathe through it. And same for when you're doing exercises. But I'm still icing a few times a day because we're just getting into physical therapy at all, sort of, you're working it even when you're only in passive. And so you want to make sure you want to keep the inflammation down. So I haven't taken any more of my heavy medication, but I've been taking Advil pretty regularly to help with the inflammation, throughout physical therapy. So 2 weeks, about a week and a half ago, actually, I started active range of motion in physical therapy after my surgeon gave me the green light to take my sling off, which is awesome, and start using my shoulder almost per usual. The two things that I can't do yet are any sort of heavy lifting. So really just don't lift anything, more or less, heavier than like a toothbrush, with the injured shoulder, and then any sort of reaching and pulling, So when I'm getting into the car, I don't reach with my injured arm and pull the door closed. I reach with the non-injured arm and pull it closed. So there's still a lot of mindfulness, even though I can have the sling off at home. He actually told me, and my physical therapist recommended the same thing, to wear my sling in public, just so people know that, like, hey, you're still injured. Don't bump into me. It's a way of communicating to strangers that, like, you need a little bit more space than maybe a normal person does. I remember the first time actually that I went out and about without my sling on. I felt so nervous. I was afraid someone was going to bump into me, and that would hurt, and what would I do, and I realized how much that the sling kind of became a safety blanket for me in a way. Like it's like it feels home, it feels protected. And to not have that at first, it was definitely kind of stressful. I still actually I haven't put the sling on at all in probably a week. So I'm feeling way more confident without it. And I'm making some progress. But if you're going to be anywhere really crowded, either don't go or put the sling on so people kind of know that, hey, you're injured. Give me a wide berth. So yeah, in terms of physical therapy now, I can start activating that muscle again, so I can do a broader variety of exercises, which is great. But it also means that things are starting to be way, way, way more sore because you're activating everything again. So actually, I have the sheet of exercises that I got from my physical therapist's office just to give you a sense of what I'm doing. Here's kind of an example of some isometric exercises with a ball against the doorway, basically just not punching it, but just kind of putting some pressure on it to keep the ball in place while also exercising and activating those muscles in the shoulder. This is sort of to work on some range of motion here, like kind of holding a stick and working on getting your arms out to the side and up above your head. External rotation is the most painful thing. Just trying, moving my shoulder, moving my arm out as opposed to in, because it's super comfortable in, because that's where the sling's been holding it. So trying to rotate it out, that's going to be I think the hardest thing to get back, as well as reaching behind my back. Those are kind of the most painful, most stiff exercises for me right now. Other cases might, obviously every body is different. But for me, that's the hardest thing to do and the most painful thing to do. I also want to note that sleeping is just not that comfortable for me still. It's gotten better, but I thought that it would kind of go away at this point, and that I would be sleeping a lot more comfortably. And I guess it's just been a much slower process than I expected. Sleeping still isn't that comfortable. Even now, I'm sleeping at a more normal angle. I don't have the pillows under my shoulder and elbow anymore. But as a natural side sleeper, I find myself in the middle of the night trying to roll over onto my injured side, and then it hurts, and I have to move back over. And so it's just sort of a restless thing. And I'm still getting plenty of sleep, but it's just not super comfortable. And I think it's going to be one of the last things to come back that feels normal. So yeah, getting the sling off, though, I have to say, made just a huge difference on my psyche and how, I can help out around the house. I can driving for the first time after I got my sling off. Still kind of made me a little nervous, but actually it came back like riding a bike, of course. The hardest thing was needing to pull into a parking space or parallel parking, just because, you're moving the wheel in extreme directions. And at first it was hard, and my shoulder is still pretty stiff. Although the good thing is, once you start active range of motion and you're able to move your arm around at home and during the day, the amount of range of motion you gain back by doing your exercises and through physical therapy actually stays, because you're able to keep moving it and reinforcing it. Whereas previously in passive range of motion only, you make a certain level of progress in physical therapy, and then you kind of it's harder to make progress because it's harder to reinforce it throughout the week when you're not in therapy. So it's nice because the first day I did active range of motion stuff in physical therapy versus the second time I did active range of motion stuff in physical therapy, I could see this huge difference just in what I was able to do and what felt comfortable. And so that's really encouraging. And actually today I got a treatment massage through my physical therapy office. They have a great massage therapist there who really knows, who kind of has your chart, works with your physical therapist to figure out what type of massage treatment will actually help your recovery. And so that felt really, actually part of it really hurt, but the good kind of hurt. to really start working through some of the muscles that have been so tight because of the sling and because of the injury. So overall, I'm doing so much better. I really starting to come back and feel more normal. I'm able to type with two hands again and write with my right hand a lot more. But even if I'm writing for a little bit and say like a birthday card or a thank you note, my arm gets sore from writing. So it's a weird sensation. So I'm really trying to ease back into things. Still have to remember and remind myself that I'm still in surgery recovery, and it's a slow process, but it's going okay. If you've just had surgery, I hope your recovery is going well too. If you're thinking about having surgery, I hope that these are really helpful for you. And if you're some of my friends and family, thanks so much for your love and support. I couldn't do this without you. Hopefully I'll update again soon. And thanks again for following along. Take care. Bye.